What is the recommended dose of folic acid for women with diabetes planning a pregnancy? A. 400 micrograms per day. B. 1 milligram per day. C. 3 milligrams per day. D. 5 milligrams per day. E. 10 milligrams per day. At what HbA1c level should women with diabetes be strongly advised not to conceive due to high risk of adverse outcomes? A. 6.5%, B. 7%, C. 8%, D. 9%, E. 10%. What is the target fasting plasma glucose level for women with type 1 diabetes who are planning pregnancy? A. 3 to 5 millimoles per liter, B. 4 to 6 millimoles per liter, C. 5 to 7 millimoles per liter, D. 6 to 8 millimoles per liter, E. 7 to 9 millimoles per liter. Which of the following is not listed by NICE as a risk factor for gestational diabetes? A. BMI more than or equal to 30 kilograms per square meter, B. History of GDM, C. Polycystic ovary syndrome, D. Previous macrosomic baby more than or equal to 4.5 kilograms, E. Family history of diabetes. What is the NICE recommended 2-hour OGTT threshold for diagnosing gestational diabetes? A. Greater than or equal to 7, B. Greater than or equal to 7.5, C. Greater than or equal to 7.8, D. Greater than or equal to 8.5, E. Greater than or equal to 9 millimoles per liter. What is the first-line oral glucose lowering agent recommended for women with GDM when diet and exercise fail? A. Glibenclamide, B. Sitagliptin, C. Metformin, D. Pioglitazone, E. Insulin. Which of the following medications should be stopped before pregnancy? A. Metformin, B. Isofen insulin, C. ACE inhibitors, D. Insulin aspart, E. Insulin lispro. Which HbA1c level is recommended for women with diabetes planning pregnancy if achievable without hyperglycemia? A. Less than 42, B. Less than 45, C. Less than 48, D. Less than 53, E. Less than 58 millimoles per mole. Which of the following is a new diagnostic criterion in NICE NG3 for GDM? A. Fasting plasma glucose more than or equal to 5.1, B. 2-hour OGTT more than or equal to 8.5, C. 2-hour OGTT more than or equal to 7.8, D. Fasting plasma glucose more than or equal to 5.3, E. 2-hour OGT more than or equal to 9. What intervention is recommended for GDM patients with fasting glucose more than or equal 7 millimoles per liter at diagnosis? A. Diet only, B. Metformin only, C. Intermediate insulin plus or minus metformin, D. Delayed treatment, E. Exercise only. Should a woman with GDM be referred to a dietitian according to NICE? A. Only if glucose uncontrolled, B. Only if on insulin, C. At diagnosis, D. After 28 weeks, E. Only if BMI more than 30. Which of the following is advised as a daily exercise recommendation for GDM management? A. Yoga once a week, B. 15 minutes walking before sleep, C. Walking 30 minutes after meals, D. Aerobics twice weekly, E. None. What should women with type 1 diabetes planning pregnancy be advised about ketone monitoring? A. It is unnecessary if asymptomatic, B. Only in third trimester, C. Test during fasting, D. Use blood ketone strips when unwell or hyperglycemic, E. Use urine strips daily. Which structured education should be offered to women with diabetes planning a pregnancy? A. Only third trimester, B. Only after conception, C. Before stopping contraception, D. Only if HbA1c greater than 8%, E. After insulin is started. When should retinal assessment be offered to women with diabetes planning pregnancy? A. Within 12 months. B. At booking visit. C. At 20 weeks. D. If not done in past 6 months. E. In third trimester. Which contraceptive method is contraindicated in women with diabetes planning pregnancy? A. Combined oral pills. B. Copper IUCD. C. LNG IUS. D. According to UK MEC based on risk profile. E. All are contraindicated. When should OGGT be offered to women with prior GDM according to NICE? A. At 12 weeks only. B. At 16 weeks only. C. At 24 to 28 weeks only. D. Early and again at 24 to 28 weeks if normal. E. At 36 weeks only. What advice should be given to women with diabetes regarding pregnancy risk and duration of diabetes? A. No change. B. Risk decreases. C. Risk increases. D. Risk only in more than 20 years duration. E. Only relevant to type 1 diabetes. Which glucose levels should be used for self-monitoring in preconception planning according to NICE? A. 4 to 6 anytime. B. 3 to 7 fasting. C. 5 to 7 on waking. Or 4 to 7 before meals. D. 6 to 7 throughout. E. 3 to 5 before meals. What blood glucose monitoring pattern is recommended daily for pregnant women with type 1 diabetes? A. Fasting and post-lunch. B. Before breakfast and bedtime only. C. Fasting pre-meal, 1 hour post-meal and bedtime. D. Fasting and 2 hour postprandial only. E. Pre-lunch and pre-dinner only. What is the target 1 hour post-meal glucose for pregnant women with diabetes according to NICE? A. Less than 6.4. B. Less than 6.7. C. Less than 7. D. Less than 7.8. E. Less than 8.5 millimoles per liter. What is the minimum glucose level recommended for insulin-treated pregnant women with diabetes? A. 3.5. B. 4. C. 4.5. D. 5. E. 5.3 millimoles per liter. When should HbA1c be measured during pregnancy in women with pre-existing diabetes? A. Only in third trimester. B. At booking and monthly. C. At booking and consider in second and third trimester for risk assessment. D. Only if glucose is uncontrolled. E. Not recommended. Which insulin analogues are preferred over soluble human insulin during pregnancy? A. Digludec and glargine. B. Glulicine and glargine. C. Aspart and Lispro. D. Determine and Digludec. E. NPH and Lispro. Which of the following should be available at all times to insulin-treated pregnant women? A. Metformin. B. Steroids. C. Glucagon kit. D. Fast-acting glucose like dextrose. E. Ketone meter. Who should be offered real-time continuous glucose monitoring? A. All pregnant women. B. Women with GDM only. C. Only if on oral therapy. D. All women with type 1 diabetes. E. Only if using insulin pump. When should ketone testing be performed in pregnant women with diabetes? A. During routine visits. B. Only in third trimester. C. Only if fasting glucose is less than 4. D. If hyperglycemic or unwell. E. Only during labor. When should retinal assessment be offered during pregnancy to a woman with pre-existing diabetes? A. Only at booking. B. At 20 weeks only. C. If not done in past 3 months. At 16 to 20 weeks and 28 weeks. D. Only in third trimester. E. At delivery. Which value of serum creatinine warrants nephrology referral in pregnancy with diabetes? A. Greater than or equal to 90. B. Greater than or equal to 100. C. Greater than or equal to 110. D. Greater than or equal to 120. E greater than or equal to 140 millimoles per liter. When should ultrasound monitoring for fetal growth and amniotic fluid volume begin in pregnant women with diabetes? A. From 24 weeks. B. From 28 weeks every 4 weeks. C. From 30 weeks weekly. D. From 32 weeks only. E. Only if macrosomia is suspected. When is induction of labor recommended for women with type 1 or type 2 diabetes without complications? A. 36 to 37 plus 6 weeks. B. 37 to 38 plus 6 weeks. C. At 39 weeks. D. At 40 weeks. E. Await spontaneous labor. What blood glucose range should be maintained during labor? A. 3 to 5. B. 4 to 7. C. 5 to 8. D. 6 to 10. E. 3.5 to 6.5 millimoles per liter. What should be done if glucose is not maintained between 4 to 7 millimoles per liter during labor in a diabetic woman? A. Give oral glucose. B. Increase insulin dose only. C. Use IV dextrose and insulin infusion. D. Withhold insulin. E. Allow glucose to normalize postnatally. Which medication should not be used for tocolysis in women with diabetes? A. Nifedipine. B. Atosibon. C. Beta mimetics. D. Endomethacin. E. Magnesium sulfate. When should babies of women with diabetes have their first routine blood glucose check? A. Immediately after birth. B. At 1 hour. C. At 2 hours to 4 hours. D. At 6 hours. E. At 12 hours. Which condition is not listed as a reason for admitting a baby of a diabetic mother to NICU? A. Hyperglycemia with clinical signs. B. Neonatal encephalopathy. C. Feeding well and normoglycemic. D. Polycythemia requiring exchange. E. Born before 34 weeks. When can babies of women with diabetes be transferred to community care? A. At 12 hours of life. B. After 24 hours if feeding well and normoglycemic. C. At 6 hours if glucose normal. C. Immediately after birth. E. After 36 hours only. What is the minimum pre-feed blood glucose level to be maintained in newborns of diabetic mothers? A. 1.5. B. 2. C. 2.5. D. 3. E. 3.5 millimoles per liter. What is the initial feeding advice for neonates born to diabetic mothers? A. Feed only on demand. B. Start feed after 1 hour. C. Feed within 30 minutes and then every 2 to 3 hours. D. Tube feed every 4 hours. E. IV glucose after 2 hours. What should be done if neonatal glucose remains less than 2 despite maximal feeding support? A. Wait and recheck in 6 hours. B. Add oral sucrose. C. Start IV dextrose. D. Continue breastfeeding only. E. No action needed. What test is used for neonatal glucose monitoring as per NICE? A. Urine glucose dipstick. B. Lab glucose only. C. Ward-based glucose electrolyte or lab method. D. Home glucometer. E. Capillary lactate. When should insulin be reduced in women with pre-existing insulin-treated diabetes after birth? A. After 48 hours. B. Immediately after birth. C. Day 3 postpartum. D. After neonatal glucose stabilizers. E. After discharge. What risk should be explained to breastfeeding mothers on insulin? A. Low milk supply. B. Increased insulin resistance. C. Postnatal hypoglycemia. D. Mastitis. E. Postpartum hypertension. Which medication can be resumed postpartum while breastfeeding in women with type 2 diabetes? A. Glibenclamide. B. Sitagliptin. C. Metformin. D. Pioglitazone. E. all oral agents. What is the recommended postnatal screening for persistent hyperglycemia in women with GDM? A. 2-hour OGTT. B. HbA1c alone. C. Fasting plasma glucose 6 to 13 weeks. D. Random glucose. E. Capillary glucose daily. What fasting glucose value indicates high risk of future type 2 diabetes postpartum? A. Less than 5.6. B. 5.7 to 5.9. C. 6 to 6.9. D. Greater than or equal to 7. E. Greater than or equal to 8 millimoles per liter. What HbA1c value postpartum indicates low probability of diabetes? A. Less than 39. B. 39 to 47. C. Greater than or equal to 48. D. Greater than or equal to 42. E. Greater than or equal to 46 millimoles per mole. How often should HbA1c repeated in women with prior GDM and normal postnatal test? A. Every 6 months. B. Annually. C. Every 2 years. D. Only if symptomatic. E. At next pregnancy. What test should be offered in future pregnancies for women with prior GDM? A. OGTT only at 28 weeks. B. HbA1c at booking visit only. C. Early glucose monitoring or OGTT. D. No test needed. E. Glucose challenge test.